Hello and welcome. This is The Quarantine Life, and today we continue with part 4 of the What Went Wrong series and have a deeper look at how America became the epicenter of the coronavirus. I just want to do a quick shout out to Dr. Anthony Fauci. Here you have an esteemed medical professional, caught between a rock and a hard place. As we've previously highlighted, Trump removes those who disagree with him. And I truly believe that Dr. Anthony Fauci knows this and is trying to ensure that the public gets accurate information out while simultaneously trying to not get removed and replaced by a Trump sycophant. I have no doubt that this would be a very difficult task, so massive props to him. We can't talk about how the United States became the epicenter without talking about the United States health system, the system that is tasked with dealing with a localized viral crisis. The US healthcare system is a complex mixture of both private and public facilities, institutes, and insurers. I won't go into specifics regarding healthcare, but what I want to do is focus on factors involving healthcare that most likely impacted on the United States becoming the epicenter of the coronavirus. First, I think it's important to note that a lot of Americans do not trust the US healthcare system. In a 2018 Gallup poll, only 36% of Americans reported that they had a great deal or quite a lot of trust in the medical system. Part of the reason is due to the way that the healthcare system is set up. In the United States, there is a greater autonomy for hospitals and clinicians, and therefore any problems within the system are blamed not just on the government, as they might be in countries like England or Australia, but on healthcare providers. The big problem here is that those who don't trust their physicians are less likely to take their medications, follow doctors' advice on healthy behaviors, and more likely to skip vaccinations. Part of the problem appears to be that people don't trust the healthcare system, and thus don't trust doctors associated with those institutions. Continuing on though, Trav Culler, a New York physician, wrote that perhaps most concerning is evidence that low levels of trust can weaken the ability of governments and public health agencies to respond to epidemics. The study referenced in this article looked at Liberia during the Ebola epidemic, and suggests that Ebola spread more widely and persisted longer than it otherwise would have if there was higher levels of institutional trust. Before moving on, I just want to make it clear that the purpose of this video is not to be a debate about private versus public health insurance or the pros and cons of universal healthcare. However, I'm curious to know what you all think of the US healthcare system, so please leave a comment down below. In the United States, around 58% of healthcare facilities are operated by the private sector. The United States currently spends a massive percentage of their economy on healthcare. They spend almost twice as much as the UK and Australia, which both have universal healthcare. A lot of the costs are chalked up to administration costs, which are sometimes called back-end functions, which basically means that a lot of people are sticking their hands out to get a piece of the money flow from medical expenses. Part of the distrust in the healthcare system appears to come from the disconnect between how much Americans pay for healthcare versus how much they actually receive. As I said previously, I don't want to go too deep into it, but basically the hospitals, pharmaceutical companies, and other institutions charge individuals whatever the price they want, and then the insurer will negotiate them down. In fact, generally, the only time that most patients find out the price is after the treatment has been delivered. Unfortunately, what this appears to create is not only distrust with the healthcare system, but also the fear of potential bankruptcy, due to the possibility of an exuberant hospital bill for treatment. Sadly, compounding this is that in the United States, there are around 30 million Americans who are without health insurance. Health insurance in the United States is generally privatized, with 67% of the population having private health insurance coverage. In addition to this, health insurance in the United States is generally tied to having a job. So if you don't have a job, you don't have health insurance, which is a key factor we will address shortly. It has recently been reported that Vice President Mike Pence met with a group of large private insurers who agreed to waive co-payments and deductibles for coronavirus tests. However, the National Trade Association, American Health Insurance Plans, clarified that the out-of-pocket costs for treatment would not be waived, meaning that people who face deductibles could be on the hook for large costs. Even with private health insurance or employer-based health insurance, a recent study looking at the cost of inpatient admissions for coronavirus treatment in the United States predicted that the average cost of coronavirus treatment for someone with insurance would total around $9,700 for someone without health complications, and for someone with complications, it could top $20,000. However, the insurance that someone would pay out of pocket varies depending on their plan, but the study estimates that it could exceed $1,300. Just to give you an idea of how big the hospital bills could be if you didn't have health insurance, there are reports of coronavirus treatments in the United States exceeding $34,000. And you can imagine, even in the best case scenario, if you had to fork out $1,300, which isn't a lot of money to own, but is a lot of money to owe, it would dissuade people from seeking medical help during the coronavirus crisis, and thus lead to deaths and increased spreading. The crazy thing is that a recent survey revealed that 69% of Americans have less than $1,000 in savings. Even worse than this is that 45% of Americans say they have $0 in savings. You can imagine, with the cost of hospital bills, medicines, and other costs, adding in a pandemic could be devastating for the average American. In fact, 54% of Americans already worry about the expenses tied to coronavirus, as they say that they're not prepared to handle a contagious disease that may limit their ability to work for weeks. Continuing on this though, only 29% of workers are able to work from home, and while 73% of workers nationwide have access to paid sick leave, most do not have enough accumulated to be able to take off 14 days for quarantine. The big problem here is that it's a catch-22. You either take time off work and are potentially unable to support yourself, or you go to work and you spread the virus even further. As we now know, many people may in fact be asymptomatic, and this is going to be a huge problem in the United States in attempting to limit the spread. Unfortunately, due to the coronavirus crisis, there are now more than 10 million additional people filing for unemployment benefits, with some economists predicting a loss of at least 20 million jobs. Just have a look at the graph explode. The really bad thing though, is due to not having a job anymore, a lot of them lost their health insurance. So unfortunately, summing up healthcare in the United States, you have general distrust of the healthcare system and associated medical professionals, healthcare that is cost prohibitive to many Americans, people with limited ability to take time off work to survive, and the general issue that if you don't have insurance, you may be potentially turned away from receiving medical treatment. Lastly, to finish off, we need to introduce another player called Mitch McConnell, who is a Senate Majority Leader. Apart from all the numerous atrocious things he has done during his tenure in the United States, I want to focus in particular in regards to the coronavirus. Basically, recently he claimed that impeachment prevented action on the coronavirus crisis, and apart from being an asinine defense, we should investigate a bit deeper. Firstly, it's important to note that impeachment ended on the 5th of February 2020. And what was Trump as president doing during this time? Well, he was going to the golf course and holding rallies. Rather than focusing on the coronavirus crisis in the early days, he was promoting himself and enjoying himself, and not to mention funneling money into his own pockets through his results. In fact, Trump has spent the equivalent of 334 years of presidential salary, or more than $133 million, to golf at for-profit resorts, including his own at Mar-a-Lago. And just some quick maths, if we take the average cost of a ventilator at being around $40,000, that would equate to an additional 3,345 ventilators being available right now. I also want to highlight something very interesting regarding his daily press briefings since enacting rules about social distancing, restricting his ability to hold rallies. The Trump administration has not held White House press briefings for over a year, as of March 11th, 2020 as noted here. But then, all of a sudden, we had the coronavirus task force briefings pop up. As previously mentioned, the main reason for this appears to be that since he was unable to hold his rallies, he and his administration realized that he could use the coronavirus press briefings as a substitute for the rallies. The sad thing is, this has continued Fox News in propagating their agenda, and thus the cycle between Fox News and the Trump administration continues. Here we can see that Fox News reports that Trump's daily briefings are a success. The really big problem here is that the coronavirus press briefings should not be used as a political tool, but instead as a factual and informative session delivered by health experts and those most adept at handling the coronavirus crisis. Millions of Americans rely on appropriate and relevant information during this time to prevent the spread of the coronavirus and help those who need it. This is not the time for promoting one's political agenda. In good news, it appears that the media is catching on to this, with journalists skipping the daily coronavirus press briefings, saying that they just don't offer enough news value. As anyone who has watched any of these press briefings would know, instead of delivering key information and a somber assessment of the situation to the public, he has used the same tactics from his campaign rallies to boast of his accomplishments, push misinformation, attack the press, and taunt Democrats. Going forward, please trust the health professionals and respect the amount of effort those having to deal with the problem have to face. They didn't create the problem, but they'll be the ones fixing it. Wrapping up, I think it's really great to see recent news articles continue to hold Trump and his administration accountable for their unbelievable incompetence. It is important to never forget that the Trump administration could have prevented the majority of this. Thousands of people have already lost their lives, and millions are experiencing hardship and pain as a result of their ineptitude. And I ask all Americans to please go out and vote in November. Do everything you can to get your neighbor to vote. It seems cliche, but the world literally depends on it. Lastly, I hope all my American brothers and sisters stay safe during this time. We're all in this fight together. Thank you very much everyone for making it to the end of the video series. If you like this type of content, please support the channel by smashing the like and subscribe button with your hand sanitizer. Feel free to share this series to anyone who you think may benefit from the information. If you have any questions or suggestions going forward for other topics or content, please leave a comment down below. And as we always say here, don't forget to wash your hands.